Hello, everyone. Welcome back to the channel. I'm your host, Mahmoud. Today, we have a special guest in our podcast. We have Ashish Jamin joining us. He is the founder and CEO of Needle Lab. Um, I will let Ashish introduce himself and a little bit about yourself. First of all, Ashish, thank you for joining us and welcome to the podcast.
No, thank you, Mahmoud. And uh, I'll just did I am I pronouncing your name right? Mahmoud, right? Or
Yeah. Let's go, Mahmoud.
Mahmoud. Right. So thank you, Mahmoud, to for the invitation. Love to chat with you and share some of my background, what we're building. And as you said, let me introduce myself. So I'm Ashish, uh, founder and CEO of Needle Labs. We are building a payment integrity platform for health insurance companies. And I'll talk more about what it means, right? But just for as a background. We started this company in stealth mode almost a year and a half back. Uh, I spent 20 years at Microsoft doing very interesting things, leading product teams, engineering. At one point, I led policy team, uh, writing policies around deep fakes and disinformation defense. Uh, and prior to joining Microsoft, I was part of two early stage startups, uh, early in early 2000s, essentially, right, where there was a lot of hype around internet and the bubble and whatnot, similar to what we see now with AI, but
Mhm.
I feel they're very similar, but they're different hypes. And we'll go into details.
We'll go into that. I have so many questions.
Yeah. So as a background, so this is what we do. Needle Labs, as I said, is a payment integrity platform for health insurance companies. Payment integrity typically is, from an insurance perspective, is are they paying the right amount at the right time for an accurate claim, right? So, in the journey of healthcare payment, right, what happens is, uh, let, I'll take myself as an example. So, let's say I'm a patient, I'm a member,
Mhm.
meaning I have an insurance through my employer. Typically, that's what happens in the US. I can also have insurance through ACA,
Mhm.
Affordable Care Act. So the idea is like, hey, I have access to care,
Mhm.
meaning that I have this insurance and I have access to care if anything goes wrong or I need any procedure, medication, and whatnot.
Sure.
Right. So that's where it starts. I pay some insurance. My employer pays insurance, but that gives me access to care. And let's say something happens to me, I fall and I break my knee. Right. Haven't had
Well,
it.
God forbid.
Regret, but let's say that happens, right? So I end up going to a hospital or what in the technical term they're called providers. So you have
Mhm.
patient, which is an individual, you have provider who is providing the service, right? Then that's like point of care, right? It could be an outpatient service, an inpatient service, it could be a pharmacy, right? If I'm getting medication and whatnot. So I end up going to a provider. They do procedure on me. They fix my knee. They keep me in hospital for 2 days, whatever. I come back. At that point, what happens is a provider takes packages, whatever they did, essentially,
Mhm.
right? They may have done some surgery on my knee. They may have given me some medication. They may have put me in anesthesia. I like whatever, right?
Sure.
Uh, they package everything together and they call it a claim, and they
Mhm.
file the claim to the insurance company, which I have insurance from.
Mhm.
Uh, so provider then goes to file the claim. An insurance company in this world, in a technical term, is called a payer. So you have a
Mhm.
patient, you have a provider, and you have a payer. It's a three-sided market, essentially.
Mhm.
A payer is the one who will actually pay for the claim, right? They do multiple things as well. They do some verifications, validations, blah, 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 and they end up either paying the claim or asking more information about, the procedure, or they may deny the claim,
Mhm.
right? And if they pay the claim, they pay, sometimes it is paid on multiple axes, and I'll talk about that too.
Sure, sure.
And and the whole idea of paying the right amount at the right time for an accurate claim is what payment integrity is all about, right?
Mhm.
Ensure that the payer, because there's a lot of fraud, waste, and abuse, right? So, the US healthcare economy is around $4.9 trillion,
Oof.
right? And almost $935 billion are around administrative waste, fraud, leakage, whatever you want to call it, right?
Mhm.
So think about like almost 22% is actually wasted, right?
Mhm.
Out of that, because it's a huge ecosystem, you have providers, you have insurance companies, you have pharmacy, you have TPAs, third party, they call TPAs, adjudicators, more or less. You have urgent care services, you have, like, so there's a lot of things that go on, and there's leakage on every point, right?
Mhm.
On the payer side itself, on the claim, there's a leakage of around $100 billion, right? So what we are doing is we are actually building an AI native platform to eliminate that 100 billion leakage for a payer, right? And it's a astonishing number, but what it translates into is almost $28 per member per month back to affordability of access to care.
Mhm.
Right, so that's what we are doing.
Cool, cool. So you did mention about fraud, right? So can you give me an example, like how and what kind of fraud might happen in between the payer getting the claim and paying, right?
Yeah, they typically in the industry it's called fraud, waste, and abuse, right?
Mm-hmm.
So fraud is knowingly, right, making sure that the claim is misrepresenting the procedure or the care that was given, right?
Mm-hmm.
Waste is, there could be administrative waste, there could be, like anything that could be waste. Like, and I'll give you examples of each, right?
Sure.
Waste is, just because it's a huge market, many entities are involved, right? There could be wastage of administration, so and other things, right? There could be,
Mm-hmm. Mm-hmm.
you know, abuse is essentially, you can think fraud is knowingly, abuse happens unknowingly, right? Right.
Mm-hmm.
That's how you call fraud, waste, and abuse, right?
Yeah, yeah.
Now, examples can very well be on a fraud side that there could be a little provider service, right? An urgent care or whatever. They they may end up actually giving me a wheelchair. They may give me crutches for my knee thing,
Mm-hmm.
and they may actually put a claim that, hey, they gave me a wheelchair.
Oh,
Simple example, right?
mm,
Mm, happens,
sure.
right? Uh,
Mm-hmm.
that can, right? For I'll say waste, right? Waste could very well be like, hey, I did not need ambulance services, but I ended up getting it, right?
Right,
For
right.
whatever reason, right? So they were like, hey, it was not needed, but
Mm-hmm.
for whatever reason, it was scheduled. I got picked up in an ambulance or whatever. So that's like kind of wasted, actually. Like,
Mm-hmm.
you know. Abuse could be like, hey, my knee procedure could have been an outpatient procedure. You could have done it in 2 hours, but you ended up actually putting me in inpatient and one day of inpatient services, changing a hospital bed, and there's so much,
Right.
right? Again, there's a thin line between what is done knowingly and what is done unknowingly, right?
Mm-hmm.
And at the end of the day, fraud is the biggest problem. Waste and abuse, because it's a huge system, huge economy. Wastage is bound to happen. Abuse is, doctors would make a decision at the end of the day, right? They are the final giver of the care, they would make a decision. And if they end up keeping a patient for, let's say, a day instead of a couple of hours, that's their discretion. Sometimes insurance companies would actually ask for additional documentation to verify that, hey, it was like genuinely or by mistake or whatever, right?
Gotcha. Mhm.
Yeah.
Cool, cool. Very fascinating stuff. I've worked in healthcare before. I worked for Metadata Solution back in 2012, 11, 12, 13. They are more on the clinical research and trial and
Mhm.
all that. So this side was not very familiar for me. So this is interesting. So now that we know a little bit about the industry and what fraud and waste is, so where does Needle Labs comes
Yeah.
in and how does it address some of
Yeah.
these?
So we come in multiple facets essentially, right? So I'll first tell you what we do,
Mhm.
and then we can talk about where we fit in into this whole idea of payment integrity, right?
Sure.
So what we have done is, like, at the end of the day, we are a neuro-symbolic platform, AI platform, right? So we use AI, but we also use so AI in a traditional terms like neural networks, right? Which is
Mhm.
pattern recognition. We can at scale actually extract information from unstructured to structured, right?
Mhm.
Use AI, we can do vision. We have vision models. We do OCRs. We have document analysis models, and the basic idea is uh, let me actually take a step back. So most of this ecosystem runs on documents, right?
Mhm.
Doctors' record, medical records. You have doctors' notes. They write. You know, you have policies which are written, right? You have contracts between a provider and a payer. They are complex documents. Policies are complex documents. You also have timesheets of nurses, or you also have bills and like receipts and whatnot, right? So there's a lot of documentation. When I say documentation, it does not mean like, hey, everything is handwritten, but
Yeah, yeah.
at the end of the day, these are unstructured uh, data.
Right, right. Different companies, different step might have different format of data. You have to
The
also.
format is like there is some standardization essentially in the claims, and especially on the claim side. There are CMS guidelines which actually do you have a schema and a format, and an API endpoints where the claims go back and forth.
Mhm.
But the documents like medical records could be different, right? Based on the EHR. Uh, so a lot of unstructured documents. And when,
Mhm.
when we started thinking about it, how can we actually, the base of our platform is we can extract structure out of any unstructured data, right? So now I go back to neuro-symbolic, right? So what we do is, at scale, we can extract structure from complex medical documents, right? It could be claims, it could be policies, contracts, doctor's notes, clinical charts, whatever,
Mhm.
right? And what we do is AI, we use AI, not just, LLMs, right? We use
Mhm.
LLM little bit,
Mhm.
uh, but we do, as I said, we have multiple models. We do vision to OCRs to document analysis to uh, uh, other anomaly detection models. Like we have a bunch of AI models, right?
Gotcha. And
And then,
this, it's like a data pipeline ETL system that runs through.
yeah, in a traditional sense, you can actually think of it as an ETL system, right? Where
Mhm.
we can extract at scale using neuro-symbolic.
Yeah.
Now, where the symbolic comes into the picture is when we LLMs, or AI,
Mhm.
gets you accuracy, but not as high, right? So
Mhm.
they will, especially it's a pattern recognition engine, right? It's a probabilistic, non-deterministic mechanics to get data out, right? From a core engineering perspective. So it's non-deterministic, meaning that if you use some LLM, it may hallucinate. It may actually not get you exact, but it can make things up and whatnot, right? Even if you do vision models, it may actually not be able to get everything right. So accuracy is the state of the art models could be like anywhere from 80-85%, just like if you really, really do good job, right? And the
Mm-hmm.
documents are all kinds of different documents as well, right?
Yeah.
So we use those, but then we also have what we call is uh, uh, fine-tuned on the context or the domain itself, so healthcare domain. So there are some models that we have fine-tuned based on clinical information, so that the models actually do produce better results for healthcare domain, right? So they understand what an ICD code is, just
Mm-hmm.
for example, right? We also have a taxonomy where they understand that, hey, a cardiac uh, arrest and a heart attack are actually same, right? Because
Mm-hmm.
documents may have differently
Right,
class,
right.
right? But we can do that. So that's where we use neural networks, a bunch of models. What symbolic does is that essentially it's a deterministic way to say that, hey, uh, uh, it's deterministic to say that, hey, you whatever you're extracting is actually accurate, right? It's a rules based engine essentially. So we extract at scale, then we use this rules based engine to get a very high level of accuracy, right? And whatever we extract, we create what we call a knowledge base. No, you can call it knowledge library. We also have a knowledge graph, right? And so think of this, as you said, ETL pipeline. So we have extracted, right? We have run rules, uh, and then in the end, what we have is like you can think of as a huge database which has all the lineage, the graphs, the node, the vertices, everything else, links, as well as we do vectors and embeddings there as well. So you can think of it as a big, huge data set, right? Now we are ready to be plugged in wherever in this payment ecosystem is, right? So
Mm-hmm.
that's what we do. At the end of the day, it's a neuro-symbolic AI, which ends up creating a knowledge graph, knowledge base, knowledge library that can be plugged in. So that's what our product is.
Oh.
Now, let's talk about the use case, right? So, three use cases in payment integrity. One is prior auth. So, what happens is the same case, I'll take me as a patient, right? I go to, I have chest pain. I end up going to an urgent care saying, hey, I have chest pain. They say, it may be something to do with your arteries, right?
Mm-hmm.
So they say, all right. So they kind of create what they call an estimated claim, right? Meaning like, hey, this is the thing that we do with Ashish, blah, blah, blah. And typically, they would have to prove to the insurance agency that it's medically necessary for Ashish to go through this, right?
Right.
And it's called prior
And is
authorization.
this before they do anything or?
It depends, right? So if I'm going into in an emergency, then no,
Mm.
right?
Okay,
Then they'll
gotcha.
just do the procedure.
All
But
right.
I'm laid back, something is happening. I go to like a hospital to go to my provider, right? Take doctor's appointment. I go 2 days later and say, hey, this is what is paining me and happening to me for last 2 days. And then yeah, looks like some artery. Why don't you come and then we'll do something, right? At that point, the doctor may say, if I have to do, like, say, a bypass surgery,
Mm-hmm.
giving you an extreme example, right? And,
Hopefully not again. You
and
just
then,
broke your knee a little while
yeah,
ago.
yeah, that's fine. I'm in the industry, so I'll take myself as the guinea pig here for my examples, right? So if I go there, then what they call we're doing medical necessity and prior authorization from the insurance company.
Mm.
Now, when the prior auth requires them the hospital to send my medical history, my benefits, whatever I have through my insurance, doctor's notes and whatnot, right?
Mm.
And today, what happens is when they send it to a payer, uh, unless it's an urgent request, payers would take their sweet time of 1 week to 4 weeks to say you can do it or not, right?
Yeah, yeah.
Now we come in, we say, hey, we have all this here, right? And I'll share why they take longer, right?
Mm-hmm.
When the documents come, you just run. So essentially what we have done is we have taken whatever the complex documentation things, the problems are, we have created the knowledge base. So these documentation problems become a computational problem now. So
Right.
as soon as the documents come, we can run this against our knowledge graph
Right.
tools, and we can in sub-second say,
Yes
yeah,
or no. You can just give them the final decision based on whatever this
exactly.
guy was supposed to do in 1 week.
Now, yes, there are some complex cases where they would still need a medical doctor to verify and look at it,
Sure.
but we're shortening that. So essentially, right now, these 80% of these are actually quickly turned back, around 15 to 20% required additional registered nurse or medical doctor's view. What we are saying is we actually, because of our platform, will reduce that workload to 2 to 5% only. To essentially, on a payer side, it
Mhm.
would save them not only dollars, but it also would give providers a quick way to actually make sure that the patient is receiving the right care, right? So that's
Gotcha.
the use case, right?
Mhm.
Now let's say it happened with me. I went to the bypass surgery, blah blah blah.
Mhm.
Now the claim is actually ready. They submit, right? Now there are technologies right now, and everyone has it, which actually can do almost again the same thing. 80-85% the claims can be adjudicated right away, right? Because
Mhm.
they have done it. But then what we are doing is, again, you plug in our system in the prepay adjudication side, and we can do sub-second requests. So we also reduce that time. So it's on the prepay. Then on the post-pay, what also happens in the industry is insurance companies would look into their claims and policies and contracts and everything, and they can actually go back up to 2 years and then look if they overpaid, or was there some fraud, waste, and abuse,
Mhm.
right? And there are mechanics built into the law where they can go and recoup that money,
Mhm.
right? So now we also can plug in into post-pay. That's where it really is called post-pay integrity. So essentially making sure that retrospectively we can actually do that analysis, and we can give that um, evidence back to the payer saying, hey, you lost this much dollars with this provider, and here is how why you lost it. Because what we can do is when the claim comes in, we can layer it the policy that you have based on what the procedure was in the contract you have with the provider, the everything else, right? So that's where we can plug in.
Cool. This is fascinating. I'm just like listening to it. It's pretty awesome. And yeah, so basically um for them to analyze and approve a claim is much more easier, faster because they don't have to do all this manual checkup and lookup, which you
Right.
already have, you already created a knowledge-based system, so your system can just say, okay, yes or no, it's ready
Right.
to approve or
Yeah.
not.
It's the rules-based in general. At the end of the day, we convert a document into set of prologue rules, right? Where
Right.
it can just be executed.
Yep. And they can decide, they can, if anything changes, you can just change
Yeah,
back.
that's another benefit of our system is, like,
Mm,
let's say a policy gets updated, let's say they get a new contract or a new drug comes into the market, whatever,
mm,
right? CMS comes with the new policy.
right.
We can quickly ingest that and then update this knowledge base, right?
Gotcha. Yeah.
Current process right now is, and there are a few things that I'll also share. The current process is very human led, right?
Mm,
Meaning that, when the policy changes, there are people who look into the policy and say, hey, these are changes. Then they will hand code the rules, which goes into the rule system, and that's what they execute. What we are saying is, like, we'll keep on monitoring these changes, we'll update the rules using AI, because that's where AI
gotcha.
really scales, right?
Right,
That's where
right, right.
the
The
value.
manual labor, yeah.
Yeah. Now, the value proposition that we are bringing, right? We're not actually saying, hey, you can actually have less people, right? What we are saying is you actually would save money. So your people that
Mm,
right now are manually doing this work, they now become superhumans, right?
right.
The basic idea is now they are not doing this mundane job. And I'll
Mm,
tell you one interesting data point. So typical nurses, right? Uh, they would spend almost like 10 to 15 hours, right, working on the claims versus they should be working on the care, right?
yeah.
Taking care. patients, right? But
Yeah.
there's so much documentation and whatnot they have to do, right?
Mhm.
That they are wasting the doctors and practices are frustrated that their nurses who are supposed to actually do the job of taking care now are wasting their efforts to work on claims. But we can actually solve it for them,
Yeah.
right? That's one. The other side is, you know, what happens is because it's a very human-led uh, workflow right now, what happens is when the claims come, the payers have some artificial threshold. They say, hey, we'll only review claims which are more than $50,000. So
Mhm.
anything below $50,000, if a provider, let's say a bad adversarial, bad provider, fraud provider, understands this mechanic, they'll actually send claims which are like 49,000,
49,500.
right? Because they won't get reviewed. What we are
Yeah.
saying is like, hey, because AI will improve your coverage to 100%. 100% of the claims can go through this, and your people can now focus on the claim which are really problematic rather than just focusing on 50,000 and more, which may be less problematic because
Yeah.
these are big claims, big coming from big providers, may actually uh, be waste and abuse, not fraud, but we can
Mhm.
detect that, right? So again, we are working on both sides to making sure that hey, your people actually can do more and do better using AI rather than saying, hey, AI can solve it. No, AI is actually uh, is part of that solution, which is very human driven. So we have mechanics built into our platform, which are human in the loop kind of concepts.
Gotcha. Yeah. No, you bring up a very good point because when we started Axion AI, this is one of our like business motto, mantra, whatever you want to call it. We came in with the idea of that we're not in a human replacement business. We're all we want to do is to make them efficient and do more within the same amount of time with much less effort
Yeah,
and
exactly.
so that they can example is we are in talk with a healthcare provider. They are it's a very small company, but the provider is doing the advertising, they're running the ads, they're doing all this stuff, and as well as picking up calls and scheduling and so on and so forth. We went in and we're like, I can take care of this, this, and this, so you guys can focus on the actual thing that you're trying to help people with. And it's a no-brainer at that point, right? Because they're not big enough to hire more people.
Yeah.
And we're not cutting anybody's job. We're just keeping them same and scaling up vertically. So yeah, that's a very good point. And I wish all the companies have the same same mentality. But that being said, so who are your clients and how do you reach out to them? So I'll ask you three-part question. So who are your clients? How do you reach them? Like what's your process to reach them? And do you have any competitors? You don't have to name names, but why are you guys better than your competitors if
Yeah.
you have any competitor?
So let's start from the top. So who are my key customers, right? So my
Hmm.
key customers are insurance companies, right? Now they're United of the world, Anthem United, CVS is part of I think Anthem,
Yeah.
uh, and Kaiser. They're big, right? Avalon Health. They're big insurance companies. I don't think they'll actually be interested in a small startup like me.
Hmm.
But I can do a better job than their existing platforms. That's another story altogether.
Yeah.
But hey, my key customer cohort is insurance companies, but my sweet spot is what I'll call the mid uh, to large insurance companies. Uh,
Hmm.
and you'll be amazed that there are around 1,500 insurance companies or payers in the
Yeah,
US.
I only know like 10.
Yeah,
It
there's
is, yeah, absolutely.
local markets, right? There are insurance companies who are 500,000 members, a million members,
Mm.
300,000 members, right?
Yeah.
Uh, so so uh, so the challenge with these I'll say small, medium, and large is, and extra large is like United and whatnot, right? Let's
Mm-hmm.
not talk about them, right? Uh, is that, hey, one is, so insurance companies, there's another challenge. It's called medical loss ratio, right? MLR. So with ACA, Affordable Care Act, there's a mandate that an insurance company's MLR, medical loss ratios, uh, could be uh, could be no like they have to spend. MLR is 80 to 85%, meaning that uh, sorry, 85 to 90%. What that means is 85 to 90% of the dollars they have to go through the claims itself,
Mm-hmm.
right?
Mm-hmm.
Paying the claims. So then these companies only have around 10 to 15% of dollars for their operational, administrative, technology, whatever else, right?
Mm-hmm.
And that is another challenge that they have is because it's a very people-centric business, they typically would just let go of the dollar that they're losing, right?
Mm-hmm.
The cost to get into aberration with the provider, to even identify what the right loss is, it's very hard because you can only spend 10 to 15% of dollars doing that.
Mm-hmm.
And that's where we come in as well, like
Wow.
especially for the small to medium to like slightly large,
Mm-hmm.
you know, because they don't have enough skills and resources. Their skill sets are very much into nurses and doctors and who can actually review the claims. But and that is my sweet spot essentially of the market that I'm after right now. Right, so your blues, right? Blues of every state, Blue Cross Blue Shields, they're called.
Mm-hmm.
Essentially they're small. Every state has one. They have cohorts, but they work individually. Then you have small ones. So those are the ones that I'm targeting for the reasons that I just explained. So that's one. The second question was, how do I reach out to them? Right.
Mm-hmm.
So who is my key decision maker in a pair? So it's typically CFO, right, and the CFO's organization,
Mm-hmm.
because they're looking at the cost, they're looking at the revenues, and they want to make sure that their cost containment programs, payment integrity is part of it, is optimized, right? So how do I reach out to them? I go to conferences, right, because that's where I can find really good customers.
Mm-hmm.
I'm very active online, LinkedIn. LinkedIn is my best buddy. Right. I'm like always every day I spend at least 2 hours in the morning reaching out, making connections, pushing my content out
Mm-hmm.
there, right? So and I also have been very actively writing on LinkedIn, right? So every week on Tuesday mornings, I'll have an article published essentially
Mm-hmm.
about this issue area, about how we do, about technology, about the pain point and all that. So that's how I reach out to them. I also have a list. So LinkedIn is my primary channel, right? From reaching a conference, LinkedIn is my primary channel, and my secondary channel is email. So I have a list of there are companies who actually can give me the list of key decision makers in a particular company. So I have a list that I can go through as well. And it's a lot of so I do a lot of work myself, right? And
Mm-hmm.
we are a small company. We are uh, 10 engineers and three of us co-founders. So overall, it's a 14 people company, right? Uh, so I'm the CEO, GTM, growth, whatever, right? You want to call me.
Yeah, I mean it somebody needs to do it, right?
Well, and I enjoy doing it too, right? Because
Absolutely. Yeah.
I'm
Yeah.
new people. I'm learning as well. I'm learning a lot, right? I don't come from this domain, by the way, right? As I
Oh,
said, my
okay.
background is I came from Microsoft, right? Running
Mm-hmm.
product engineering. In fact, my last stint at Microsoft was Copilot, consumer Copilot. So when you see a prompt to image, a prompt to video, that's what I was leading as a product leader, right? So this industry, we started by trying to solve the unstructured to structured problem
Mm-hmm.
as opposed
Mm-hmm.
engineering problem, and then we found a vertical, right, healthcare, and we found a customer who was willing to pay us, and we signed a big contract with them.
Hmm.
And we say, hey, there's something here, so now let's actually make it a really healthcare company, and then go out there and acquire customers. So let's actually go back to what you asked, right? Where do I find customers? So that's where I find my customers.
One thing led to another. Yeah, absolutely.
And the third question was like, who are my competitors, right? So I compete with, as I said, uh, these big, the very large insurance companies have their own engineering team,
Solutions. Yeah.
solutions, and whatnot. So,
Mhm.
so I compete with them. That's one. The second set of vendors in this ecosystem are like this ecosystem is like 30, 40 years old, by the way.
Mhm.
Not a
Yeah.
new thing, right? I mean, uh, so there are some big uh, uh, vendors who call they are payment integrity vendors, right?
Mhm.
But they come from a very heavy human plus technology approach, right? Most of them have like this whole traditional IBM model. I call it
Mhm.
IBM model, right? Where you have like, hey, you sell a platform, but you have 10x of people on
Mhm.
top of it, right? So essentially, that's how you scale and make money, right? So
Mhm.
you just technology is just something you talk about, but then you get people in, right? So that's what the traditional vendors are, right? Then there are new vendors who are actually doing amazing work using AI, right?
Mhm.
Uh, and we are one of them. And I'll talk to you about why we are different. But we are one of them. But the problem with these traditional, the newer vendors is uh, one of the problems is like they come from the domain, right? So one of the challenges, like when you actually are a domain expert trying to solve a domain problem, you typically don't think outside the box, right? Because you already have a
You
no,
already know everything that you need to know. You don't look
right?
into from
So
a
you
different
already
perspective.
come with this whole notion of saying, hey, I know what the problem is. I know how to solve it, and my technology takes a back seat essentially,
Mhm.
right? So now, versus why am I better? So I'm then getting there. So versus what we do is I don't know the domain, right? I just look at a problem and say, oh, this is how AI should solve it, right? Right. Rather than coming from the other side where I know this payment integrity and all my career I've seen, like if I was a healthcare professional and was in the business, all of my career I've seen, hey, this is done through people, this is done through people. Plus, can I train my people to do faster queries, right? Or can I use a technology that can actually bring all the data together? But what I'm saying is like, forget the technology. What I'm saying is like, hey, there's this amazing approach to create a big ass knowledge base, knowledge library, knowledge graph,
Mhm.
and I can just plug it in wherever, right? And I can run it in a way that is pluggable, right? So those are the key things that I think are differentiating. The key differentiation though is this neuro-symbolic AI, which is again the new field, right? Uh, if you search for it, there would be a lot of papers written, but there are only few companies who actually have implemented it end to end, and we are one of that startup, right? And the reason is not only we don't come from the domain, but we are a bunch of engineers who love actually reading
Mhm.
a lot of papers and see what we can do with them, right?
Yeah.
And the paper, the neurosymbolic paper came, we actually read, I don't know, few months back, like Berkeley had a paper, programmatic prompt engineering. The neuro-symbolic AI paper was from MIT and Stanford. So we actually read a lot of things and say, hey, this is how we can actually use this implementation wise and solve it in a domain. And that's what makes us quite unique, uh, is to have an outside box thinking of technology AI first approach to a problem.
Gotcha, gotcha. So you guys are kind of considered as the AI that we used to know, the machine learning, the AI, the image processing, that sort of data science basically. So that world, rather than the new age
Yeah, so no, we
AI
do.
for.
No. In fact, we are actually even newer age where we actually would take a very interesting paper
Mhm.
and see how we can implement it to solve a problem which we are facing, right? So when we identify a new problem, and I'll give you an example here as well, right? Is is, you know the basic idea of this whole knowledge base is easy, right? Hey, you can extract everything and put it in the knowledge base. But then when we came across this paper from Berkeley saying, hey, instead, like, can you create Prolog rules? Prolog is a language like, I don't know, 30 years old language, right? So it's symbolic AI, more or less, right? Where it's like predicates of, if X, then Y kind of language, right? If you can convert the document and create like if else then kind of rule, then you can very quickly execute and get the results back, right?
Right.
Running on the CPU,
That's
right?
the computation, right? Yeah, like
That
the
exactly.
system
So
is
so
going to do the
now, yeah,
computation.
at scale and speed. So we actually are bringing that. So when you talk about this new AI, I think you're focusing very much on like whatever everyone is calling
Yeah, the
AI or
the one that in everybody's pockets.
yeah, because everyone talks about Gen AI and LLMs and all that goodness, right? Which is good.
Yep.
But the problem that it has is like it does not work for industries like healthcare or finance because it hallucinates. It actually would start making things up. The accuracy is not. It's non-deterministic,
Right,
right?
right. Yeah.
Probabilistic, non-deterministic. Our solution is deterministic because we have a rules engine. Two
Hmm.
plus two will always be four there in my rules engine. It can never be three. It can never be five. It can never be 4.00003.
Yep,
It will
yep.
be versus an LLM, I can guide it to actually give me five, four, three, whatever, right?
Yeah, and then sometime it goes into loop and then it just
That's
keep on trying
and
to give you the same
yeah,
exact
yeah,
thing.
exactly. And then our prompt engineering also, programmatic prompt engineering. There's a paper 2 years back from Berkeley which talks about DSPY. We implemented it. We do a bunch of crazy engineering actually. That's why I'm the only one who's doing GTM because I don't want anyone in my organization, my startup, to think about going to market because they are doing an amazing job, like keeping the heads down and building amazing technology.
Cool, cool. All right, so the next question is a little bit different. So tell me where you are right now as a company,
Yeah.
point A, and ideally, if you have absolutely no challenge, no restrictions, nothing, your dream, if you're given a want, let's
Mhm.
say, where do you see this going, let's say next year, one
Yeah,
year from now on, or
yeah.
2 year, 5 years from now on?
Clarity of thought there because I've actually and leans into where we are and where
Hmm.
we want to go, right? So where we are, so we are bootstrapped,
Hmm.
right? We have, as I said, 14 people, uh, 10 engineers and three co-founders and one an advisor. We are cash flow positive because we have two customers who are paying us good, right? Uh, so that's where we are, right? Now, I am actually I talked to like I've been in the industry for quite some time. I have friends, right? Some are investors, some are doing amazing, crazy work in big organizations. I came from Microsoft 20 years,
Hmm.
and some in startups and doing amazing job running startups. So I talking to one of the friends who is a known quantity in this whole VC world, right? If I say the name, you would know the name essentially,
Hmm.
right? So anyways, I was talking to him 3 weeks back. He said, "Hey, like, are you thinking about raising?" I said, "No." He said, "Why not?" And I said, "Because I'm like, I have customers. My goal is to just get two, three more customers and then go for a higher seed or a series,
Around, yeah. Hmm.
right?
Seed
But a
round.
big one, right?" And then
Hmm.
he challenged me to say, "Hey, why are you only thinking?" Well, that's where my clarity of like thought of what I want to be comes from, right?
Mm-hmm.
So his challenge was like, okay, that's good, but if you actually would have good money, right, then your vision, whatever vision I'll paint in a bit with you,
Mm-hmm.
your vision can be actually shortened and you can execute that in 2 years instead of five.
Mm-hmm.
That's all right, that makes sense. So then he introduced me to a few VCs. I'm actually, I've had talks with almost 10 of them since last 2 weeks. One is actually going to the due diligence phase. I'm negotiating with two more, right? So the whole idea is like, hey, I am uh, in very early stages of raising as well, right? So
Mm-hmm.
that's so now the vision that I had, the 5-year vision was, if you think about what I'm doing, right? So I'm processing healthcare documents, claims, whatever. I talked about this, and I'm solving the payer side, right? Saying,
Mm-hmm.
hey, are you losing money through fraud, waste, and abuse? Are you overpaying? Right? I understand this, and this knowledge base I've built. But if you think from a provider perspective, right, these are the same documents, right?
Mm-hmm.
They have the same plans, they're the same policies, the same contracts with the payer, right? They are they are the ones who are actually have access to the medical records. They are the ones who are writing the clinical notes and whatnot, right? Here I'm reading them and trying to solve for overpayment. It's the same knowledge base. I can plug it here as well on the provider side and say, hey, let me actually solve it for your uh, underpayment issue, but more importantly, take your nurses into care more and let me do the processing, right?
Right. Right.
Understand, and then guarantee is that, hey, the claims that are processed through me, they have a higher chance of like almost 100% guaranteed chance of approving because I know what's going on there on this,
Mm-hmm.
right? So this
You
whole
basically
idea.
want to be on the other side as well. So you're on the payer side, you want to be
So
on the
I don't want
provider
to,
side.
but this is where my vision is. So my
Mm-hmm.
vision is vendors like me, which have been out for 30 years, they're big ones, they should not even exist, right? The whole idea is like there is a service provider and there's a payer. Shouldn't they be actually working through an interop layer,
Mm-hmm.
which is powered by AI, right? That you don't have any leakage, you don't have any fraud, you don't have any wastage because the platform takes care of it. So that interop infrastructure is what I want to build, right? So
Gotcha.
think about me building an interop, which is in the word of today's technologies, you can think of as Stripe for payments plus Cursor for claims adjudication. Right.
Mm-hmm.
So, Stripe we all know what Stripe is, we all know what Cursor is, coming from technology perspective. What I want to be is an interop layer of claims adjudication and payment, which is similar to Stripe plus Cursor, right? That
Gotcha.
was my vision to implement in 5 years. And when I started sharing that with others, I said, all right, so you actually want to be, you raise money, you can move very quickly. So solving for payers, my goal was like, yeah, I'll solve for payers, make good leeway, understand, make my product actually very good, then start moving left on the provider side. But with where my vision is, where my raise is right now, I'm thinking actually to actually move and bring shrink that time frame into 2 years.
Gotcha. So I guess the follow-up question would be, so you gave me a good picture from A and B. What do you think are the challenges from to go from A to B?
Yeah.
And yeah, if you cannot reach B, what would probably be the main reason that you can? Hopefully you can, but
Yeah, no, that's a fair question. So one is it's a regulated industry.
Mhm.
The guidance comes from CMS, right? Uh, so that's one big challenge for having one common platform, right? It has to be really to show value to CMS and to say, hey, this is what. And see, by the way, CMS has guidelines and mandates. They want this whole claim adjudication to be real time by end of 2026. So
Hmm.
it's not that CMS they're thinking ahead. In fact, all these claims, there are APIs that they have published that this is how your interaction and transaction should go. So
Hmm.
CMS is actually doing amazing job, right? The challenge is like technology takes time to
Build and
build and then go to
solidify and whatnot.
market,
Sure.
and everyone has to align and whatnot, right? So that's one challenge, right?
Hmm.
Again, regulatory industries, that's a challenge, right? So that's one. The second one is historically these payers and providers have this kind of uh, uh, abrasive relationship, right? Because hey, if I paid a service, I want you to pay me. And I say, no, no, you have done something wrong. I'm the doctor. I know my shit. I know what I'm doing, right? So,
Hmm.
anyways, that whole complex relationship they have right now,
Hmm.
right? So typically, what you see is there are very few vendors who actually serve both sides of the market, and
Hmm.
there is a reason for it. There is a lack of trust.
Right. Right.
Right? And the lack of trust also comes from the very fact that these are very human centric businesses on both sides. It's payment integrity on insurance, it's RCM on the provider side, right? So that's another challenge, right? So those are the two big challenges. The third one, of course, is technology, right?
Hmm.
It's like, the way it is moving, it's amazing pace. We like it. But, we have seen, like, again, my background, I've seen internet bubble, right? I was part of that. I had two startups. Luckily, the first one was sold to a bank and we survived. The second one was also acquired by private equity. But we've seen that, right? So that's another. Those are the three challenges that I see right now: is regulations, the mistrust between provider and payers, and the evolution of technology, how fast it moves, right? So those are the three big challenges I see.
Gotcha. Gotcha.
Now,
Yep.
now to your point, sorry, quickly, is like you're saying, hey, if if you can't reach one side, the other side, then what, right? So the only reason I will not reach is because of the mistrust. But again, I'm coming from a technology first uh,
Background. Yeah.
vision and execution perspective. So I've actually write about this as long as like, hey, this whole idea of MLRs and there's only limited dollars. Technology can help, and it also, but it becomes a trust problem. The payment integrity is not about dollar problem. It's not a financial problem. It's a trust problem,
Hmm.
right? And you should not have vendors like me at all in the business.
Yeah, yeah, this is fascinating. Yeah. We're almost at time, so I'm gonna just quickly try to wrap this up. And I usually like to ask all my guests when they come in because majority of my guests are long-term entrepreneur like yourself. You've been in the industry for 20,
Yeah.
30 years almost. So as a business owner, we are kind of new, right? I've been in the tech industry for almost 15, 16 years, but as a business owner, as an entrepreneur, we are young. So, what are your advice in this economy, in this tech revolution time frame, and yeah, overall, what would be the road to success?
Well, so one thing that I've learned is like show up, right? Be there all the time, right? And like it's like as I said, it's a very simple advice. But I've seen success really comes when you consistently show up, like as simple as that, right?
Mhm.
People like it's simple advice, but I've seen in my career, and I was at the receiving end, but I was also the culprit here. Like, hey, all right, hey, you know, like keep on just showing up and do the job that you're supposed to do. The persistence pays for sure, right? So that's one thing I would say, right? The journey is very hard, right?
Mhm.
You have ups and downs almost every day, many ups and downs, right? Sometimes you feel like amazingly, hey, I've cracked this code, and the next morning, damn, what's going on? I don't have a clue,
Mhm.
right? So that is also challenging, but what matters is like consistently showing up and taking having this basic understanding that this is part of the job, essentially, right?
Yeah, yeah.
Success only comes when you keep on repeating uh, uh, and showing up. Like obviously, if you fail something, you learn from it and don't repeat that. I'm not talking about that situation, but fail fast. But the basic idea is believe in what you're doing and keep on showing up.
Cool, cool. Thank you so much. Ashish, we're at time. Thank you so much for your time and valuable information. I personally have learned a lot. I knew a little bit of here and there, my personal experience, family experiences, but I didn't know as much in depth. I'm pretty sure our viewers have learned a lot from this conversation. Thank you for joining us. And thank you everyone for staying up to this point. And I will see you guys to the next one. Take care.
Thank you. Bye.